In this lecture, we are going to cover the main concepts of general pharmacology and discuss its two major branches such as pharmacokinetics and pharmacodynamics. The word pharmacology comes from the Greek language, and actually it is the science which studies interaction between different drugs, different medicines, and living organisms such as human body. As the word interaction is bidirectional process, it covers two types of actions. Actions that can develop in human body under the action of some drug, and action of the body on the drug which receives some kind of drug. And we will discuss these two types of action in our video. Also, we have some kind of applied branch of pharmacology which is called clinical pharmacology, and it studies the principles of effective and safe usage of medicines for treatment and prevention of different disorders. So, the course of pharmacology consists of three main units, which are general prescriptions, that studies the main principles and rules of prescribing different dosage forms. The second unit is about general pharmacology, which is the topic of this video. This branch of pharmacology studies the general principles of drug-body interaction and consists of two parts, pharmacokinetics and pharmacodynamics. And particular pharmacology, which is the main part of our course, that studies the different groups of drugs that may regulate functions of different organs in our body. And actually it is subclassified into the drugs that modulate functions of both peripheral and central nervous systems, drugs that can affect functions of different executive systems and organs such as respiratory, gastrointestinal, urinary system, and so on. Next, drugs that can modulate different metabolic reactions in our body, such as vitamins, hormonal drugs, etc. And lastly, variety of different chemotherapeutic drugs that are mainly used for treatment of infectious disorders, such as antiviral, antifungal, antibacterial, antiprotozoal drugs, and so on. So, according to the definition of one of the world-known pharmacologists, Lawrence Bennett, pharmacokinetics can be simply defined as what the body does to the drug, as opposed to pharmacodynamics, which may be defined as what the drug does to the body. So, step by step, we will talk about these two branches of pharmacology. And we will start from pharmacokinetics. So, pharmacokinetics is the branch of pharmacology that is dedicated to the determination of the fate of substances that are administered externally to some kind of living organism, such as human body. And once administered through the several available routes of drug administration, four pharmacokinetic properties determine the speed of onset of drug action, the intensity of drug's effect, and the duration of drug's action. And these pharmacokinetic properties include absorption. First, drug absorption from the site of administration permits entry of the therapeutic agent, either directly or indirectly, into the blood plasma. Second, the drug may then reversibly leave the bloodstream and distribute into the interstitial and intracellular fluids from the blood. Third, the drug may be biotransformed by metabolism, mainly in liver or in some other tissues, into another active or inactive substances, and this process is called biotransformation. And finally, the drug and its metabolites are eliminated or excreted from the body with urine, bile, or feces. The route of administration is determined primarily by the properties of the drug, for example, water or lipid solubility, ionization, and so on, and by the therapeutic objectives, for example, the desirability of the rapid onset of action, the need for long-term treatment, or restriction of delivery to local site. And major routes of drug administration are classified into two groups, which are enteral and parenteral. Enteral routes of administration means that they are absorbed, the drugs are absorbed through the mucous membranes of the digestive channel. And such routes are represented with oral, sublingual, transbuccal, intraduodenal, and rectal. Parenteral routes of drug administration means that they are absorbed escaping the digestive system. And these routes are represented with different types of injections, such as subcutaneous, intramuscular, intravenous, and so on. Next, inhalations, when we introduce the drug through the respiratory system. And lastly, different local routes of drug introduction, when the drug is absorbed through the skin. Next, I want to cover the main mechanisms of drug absorption, which happens during the stage of the absorption of the drug through the mucous membranes. So there are several mechanisms which can be involved in this process. First, and the most widely utilized mechanism, is passive diffusion. This mechanism is realized according to the concentration gradient, which means that the drug is absorbed from the environment with high concentration into the environment with low concentration of the active substance. And this process doesn't need any energy. And usually small non-polar liposoluble compounds are transferred using this mechanism. The second one is facilitated or simplified diffusion. This mechanism is realized also according to the concentration gradient without any energy consumption, but with the help of special transport protein systems. These transport systems are specific proteins which are incorporated in the cell membrane, which can bind with the drug molecules and form specific transport drug complex, which transports this drug molecule to the opposite side of the cell membrane, where the drug molecule is released into the cytoplasm of the cell, for example. And then the transport protein is returned back to the outer side of the cell membrane, where it can bind to the next molecule of the drug. Usually also liposoluble nonpolar compounds are absorbed using this mechanism. And one more specific characteristic of facilitated diffusion is that it is characterized by saturability. When the increase in drug concentration can lead to the increasing of the rate of the drug transport only up to some limit, after which the further increase of the drug concentration does not lead to the improvement of the rate of drug absorption. This happens because the number of these transport systems is limited in the cell membrane, and in this point the we have the situation when all transport systems are occupied with the drug molecules, and the further increase in concentration of the drug from the outer side of the cell membrane does not lead to the increasing of the binding of these drug molecules with transport systems, because all of them are already occupied by other drug molecules. The third mechanism of drug absorption is performed with the help of active transport. This mechanism is realized against the concentration gradient, which means that the drug moves from the environment with low concentration into the environment with high concentration. And this process requires energy, which is generated due to the ATP molecules. Usually hydrophilic polar substances, such as different sugars, ions, amino acids, and related compounds, are transferred using active transport. Also, this mechanism requires specific transport systems, which are the proteins that are located in the cell membrane that can bind with the drug molecules and form a complex that is transferred to the opposite side of the cell membrane, where the drug molecule is released into the cytoplasm of the cell. And later the transporting system is returned back to the outer side of the cell membrane, where it can bind to the next molecule of the drug. And this process of absorption requires the energy. Also, the mechanism of active transport requires the is characterized by saturability. That is also due to the limitation in the number of transporting systems in the cell membrane. Next mechanism is filtration. This mechanism is realized also according to the concentration gradient as the passive and facilitated diffusion without any energy, but due to the presence of specific membrane micropores between the cells, or so-called intercell fissures, and usually very small hydrophilic polar compounds and some kinds of ions are transferred using filtration mechanism. And the last one is pinocytosis, which is realized by formation of the vacuole due to the invagination of the cell membrane that covers the drug molecule, and this vacuole, transporting vacuole, is then transported to the other side of the cell, where this membrane of vacuole fuses with the cell membrane of the cell, and this results to the release of the drug molecule to the other side of the cell. So exocytosis happens, which finally results to the transport of the drug molecule out of the cell. Usually large molecules of the drugs are transferred using this mechanism, using pinocytosis, because other mechanisms, including active, passive, and facilitated diffusion, are not suitable. The drug molecule is too large for them. That's why only by pinocytosis these drugs can be absorbed in our body. The process of absorption can be quantitatively characterized by such pharmacokinetic parameter as bioavailability. Actually, this word means the ratio of the portion of the drug which was absorbed to the blood as compared to the total introduced dose. When we administer the drug by some route of introduction, not the whole amount of the drug can be delivered to the bloodstream. Some part of the dose is always lost due to different reasons. and the parameter bioavailability shows us how much of the total dose was delivered, was absorbed to the bloodstream. When we are talking about intravenous route of introduction, in this case bioavailability is always 100% because we inject the drug directly into the blood, into the venous vessel. But in all other routes of introduction, the bioavailability is always less because, as I mentioned before, we lose some part of the total dose of the drug, and this results to the decreasing this parameter. The next pharmacokinetic process which we will talk about is distribution, or the movement of the drugs from the bloodstream into the interstitial space and intracellular fluids. Quantitatively, the process of drug distribution can be described by such parameter as apparent volume of distribution, which is the ratio of the amount of the drug in the body to the concentration of the drug in the blood plasma. You can see the formula which is used for calculation of this parameter, and actually the process of distribution can be homogeneous and inhomogeneous, which means the following. If the concentration of the drug is almost the same in the blood plasma and different tissues, we call this distribution as homogeneous. We have almost even drug levels inside of the blood vessels and in different tissues, in different cells. But when the concentration is higher in the blood, for example, when the drug cannot be delivered in high amounts to the different cells, different tissues, this results to the accumulation of the drug molecules in the blood plasma, and in this situation we have less amounts of the drug molecules in peripheral tissues, and we have the significant differences in the concentrations of the drug molecules in different parts of the body. And in this case we call that the distribution is inhomogeneous. The process of distribution of the drugs to the different parts of the body depends on the several factors, which include, first of all, the level of vascularization of the tissues. As you understand, the tissues which are rich in blood vessels can receive more drug molecules, and as a result they can develop higher concentrations in this tissue. Secondly, affinity of the drug molecule to the tissue proteins. Affinity means the ability to bind. If the drug molecules can significantly bind to the proteins which are located in this tissue, they will accumulate in this tissue. And finally, the structure of different histohemetic barriers. As you know, in some parts, in some organs of our body, the structure of the vessel wall can be different. For example, in the brain, we have hematoencephalic barrier or blood-brain barrier, which prevents the movement of different dissolved substances from the blood into the tissues of the brain. And this results to the situation when some drug molecules cannot be delivered to the brain tissues, which results to inability to produce pharmacological effect in this organ. The main fractions of the drugs in human body are bound fraction and free fraction. Free fraction means that the drug molecules are freely dissolved in the different fluids of the body, such as in blood plasma, extracellular space, or intracellular space. Bound fraction means that the drug molecules are bound to some molecules, such as proteins. The importance of these two fractions is the following. Only the drug molecules from free fraction can easily move between different compartments of our body. So they can be transferred from the blood plasma into the extracellular space, because those molecules which are bound to the proteins, they cannot be transported out of the blood vessel, for example. They always stay inside of the vessel. And only free fraction of the drug can be excreted from the body, can be metabolized in liver, and can produce pharmacological effect in human body due to the binding with specific receptors or other targets in our body. So when we are talking about pharmacodynamics of some drug, we are talking that the drug from free fraction produces its effect due to the interaction with specific target in our body. The third pharmacokinetic process which we will cover is biotransformation or metabolism of the drugs in our body. So the main reason for metabolism in our body is to inactivation of the active drugs that produce some kind of pharmacological effect, into metabolites which are pharmacologically non-active. Actually, majority of the drug molecules are considered as xenobiotics for our body, so the substances which are not natural, and our body tries to remove everything that is not natural by different metabolic biotransformation of these substances. And the second reason for metabolism is the conversion of the lipophilic substances into hydrophilic substances, which facilitates their further elimination from the body. So the process of biotransformation is usually consists of two steps or two phases. The first phase is performed due to the reactions of oxidation, reduction, and hydrolysis, which mainly happens in our liver, in hepatocytes. A variety of different enzymes are involved in these reactions, but the most important are the set of enzymes which are called cytochrome P450, which perform the reactions of oxidation of different drug substances. The results of these reactions are formation of either active or non-active metabolites, which can be either excreted if they are able to be removed from the body with kidneys, for example, or these substances, these metabolites, are further enter the second phase of biotransformation, which are the reactions of conjugation with different endogenous substances such as glucuronic acid, sulfuric acid, different amino acids, methyl and acetyl groups. And finally, this results to the formation of non-active conjugates that are later excreted from the body. Excretion or elimination of drugs from the body requires the agents to be sufficiently polar or water-soluble for efficient excretion. Removal of a drug from the body occurs via a number of different routes. The most important being through the kidney into the urine. And elimination of drugs via the kidneys involves three processes of glomerular filtration, active tubular secretion, and passive tubular reabsorption. After filtration in Bowman's capsule, as the drug moves toward the distal convoluted tubule, its concentration gradually increases and exceeds that of the perivascular space. The drug, if uncharged, may diffuse out of the nephric lumen back into the systemic circulation, which significantly decreases the efficacy of drug elimination. Manipulating the pH level of the urine to increase the ionized form of the drug in the lumen may be used to minimize the amount of such back diffusion and as a result increase the clearance or removal of such undesirable drug. As general rule, weak acids can be eliminated by alkalinization of the urine, whereas elimination of weak bases may be increased by acidification of urine, and this process is called ion trapping. So you see, in order to make the process of drug elimination more effective, the drug molecules must be converted into water-soluble substances which cannot easily reabsorb through the epithelial cells of tubules in the nephron. And this process of conversion of liposoluble into water-soluble substances is performed in liver during this step of biotransformation. Also, in the process of drug excretion, some other organs may play some role, but this is not so significant as kidneys. Quantitatively, the process of elimination can be described by such parameters as, first of all, half-life period. This is period of time that is required for the concentration of the drug in body to be decreased exactly to 1/2 of initial concentration. So if we inject the drug, for example, by intravenous route, you see that the change of its concentration may look like this. So gradually the drug is eliminated and concentration of the active substance decreases over time. And if we take the initial concentration as 100%, the time point in which the concentration becomes 50% or 1/2 of initial is this point. And the period of time which is required to reduce concentration by 50% is called half-life period. The second pharmacokinetic parameter which describes elimination process is elimination rate constant. This is the rate at which drug is removed from the body. And actually the second parameter, elimination rate, is linked with half-life period using this formula. And the third parameter is called clearance. In simple words, clearance is the volume of blood plasma that is cleared from the drug molecules per some unit time, for example, per minute or per hour. Clearance can be calculated by this formula. So if we multiply the rate of elimination constant on the volume of distribution, we will receive total clearance. The second part of the lecture will be devoted to pharmacodynamics. As I told at the beginning, in simple words, pharmacodynamics can help us to answer the question, what does the drug do to the body? So Actually, pharmacodynamics studies the biochemical and physiological effects of the drugs on the body and mechanisms by which these effects are produced, as well as the relationship between the drug concentration and its effect. Most drugs exert their effects, both beneficial and harmful, by interacting with specific receptors that are specialized target macromolecules in our body present on the cell surface or within the cell. And drug receptor complex initiates alterations in biochemical or molecular activity of a cell by a process called signal transduction. And actually pharmacodynamics studies the mechanisms of the actions of the drugs. So how does the drug molecules interact with these receptors in human body? Secondly, pharmacodynamics studies the pharmacological effects of the drugs. So what kind of changes of different functions of organs or systems or cells under the action of the drug. And finally, pharmacodynamics studies the pharmacological effects of the drugs in case of the repeated introductions or in case of drug interaction when we use two or more drugs simultaneously. One of the most important terms used in pharmacodynamics is action of the drug. And we can classify actions of the drugs using different criteria. For example, by prevalence, drug actions can be resorptive or general and local or topical. General action develops after the absorption of the drug. The drug reaches the bloodstream and is distributed to different tissues and organs where it produces general action. In the second case, local action of the drug only is produced at the place of its application. For example, we take some ointment, apply it on the skin, and the drug produces its effect only in the area of drug application. By the method of contact with target organs, drug actions can be direct, indirect, and reflex. Direct action means that we have the change of the function of those organs on which our drug acts directly. For example, we use some drug which binds with the receptors in our heart, and it results to the change of cardiac activity. This is the example of direct action. The second type of action is indirect, in which we have the change of function of those organs on which our drug does not act directly. For example, we use the same drug that binds to some receptors in the heart, but the cardiovascular changes which develop under the action of this drug may lead to the change of the functions of other organs, for example, kidneys. And such action of the drug on kidney is called indirect action. And finally, we have reflex type of action, which is the result of irritation of various receptors and further changes of inner organ functions due to the transmission of nerve impulses through the reflex arch in the nervous system. For example, we apply some drug on the skin which irritates the receptors in the skin, and due to the stimulation of reflex arch, it may result to the development of some pharmacological action in the organs which are located somewhere else. By the selectivity, drug actions can be non-selective and selective. Non-selective action is developed in the different organs non-specifically, so there is no specific target for the drug. Selective actions depends on the interaction with specific substrate or receptors or some other targets, or selective accumulation of the drug in target organ. And majority of the drugs which we use nowadays belong to selective agents. By reversibility, drug actions can be classified into reversible and irreversible. Reversible actions completes after the drug elimination. So when we have the drug in the body, we have the binding of the drug with the target receptor and development of some pharmacological effect. When the drug is eliminated from the body, there is no binding with the target receptor and no effect. This is the example of reversible action. Irreversible action is the result of strong chemical binding of the drug molecule with specific target and irreversible change of the function of this target organ. For example, we may have the drug that makes covalent strong bonds with the receptor or enzyme, and such binding results into irreversible change of this target, which doesn't stop even after complete elimination of the drug molecules from the body. So despite the fact that there are no drug molecules in the blood plasma, the drug still is bound to the target protein, which significantly changes the function of the organ where this target protein is located. By expediency, drug actions are classified into main and side. Main action is the action which is usable for the treatment of specified disease, so desirable action. Side action or adverse action or unfavorable action, this is undesirable action, which actually is manifested by changes of the functions of those organs the treatment is not directed to. So anyway, when we use the drug substances for the treatment of disorders, we may have some negative effects which can develop during the treatment. Principal mechanisms of the actions of the drugs. Majority of the drugs can produce its effects, pharmacological effects, due to the one of the following mechanisms. First, interaction with receptors. We have a variety of different receptors in our body, and among all of them, those which have pharmacological relevance can be represented with adrenergic receptors, cholinergic receptors, receptors for dopamine, for serotonin, and so on. And the drugs can bind to these receptors and produce either their stimulation or blockade. Secondly, drugs may change the activity of different enzymes. Drugs can either stimulate enzymes, increase their enzymatic activity, or inhibit the enzymes which participate in a variety of different biochemical reactions. Thirdly, the drug can influence the conductivity of ion channels, specific structures in the cell membranes which participate in the movement of ions through the cell membranes. And we have specific channels for sodium ions, potassium ions, calcium ions, chloride ions, etc. And drug molecules also can stimulate conductivity, so to increase conductance for these ions, or block these channels and prevent movement of these ions through the cell membranes. Fourthly, drugs may influence on specific transport systems which participate on the movement, of transport of several substances through cell membranes. For example, we have specific transport systems which participate in the reuptake of some neurotransmitters in the synapse. And the drugs may block these transport systems, which results to the prevention of reuptake of these neurotransmitters back into the presynaptic nerve ending. Next, some drugs may act as antimetabolic agents. This means that they can suppress some metabolic reactions in our body due to the competitive antagonism with some substances which are produced in our body. And finally, drug molecules can influence on the DNA molecules, which results to the stimulation or inhibition of expression of some genes, which encode corresponding proteins in our body. So, as I told you before, one of the main targets in our body, which is responsible for the development of pharmacological actions of the drugs, are receptors. Receptor is a small protein molecule, usually found on the surface of the cell, and this molecule receives chemical signals from the extracellular space. And when such external molecules, substances, bind to the receptor, these substances direct the cell to do something, to produce some response. And here you can see the typical structure of the receptor, which is located on the cell membrane. This is the receptor for gamma-aminobutyric acid, and you see that here is the binding site for GABA. Actually, the receptor has two binding sites, here and here. And when two molecules of gamma-aminobutyric acid binds to these active sites, this results to the activation of this receptor, which results to the development of some response. And actually for this type of receptor, this is GABA-A subtype of this receptor, the response is opening of chloride channel, which is located inside of this protein molecule. And when the channel opens, this makes possible the movement of chloride ions from the synaptic cleft into the cytoplasm of the neuron that has such kind of receptor. The receptors can be characterized by several pharmacodynamic parameters. One of them is the affinity. Affinity is the chemical correspondence between the drug molecule and receptor molecule, such as correspondence between the key and a lock. This correspondence leads to the formation of ligand-receptor complex. Different drugs may show full affinity, in which we have complete correspondence between the drug and receptor molecules, and in this case the effect that can be produced is usually maximal. Partial affinity, in which, as you see, we have incomplete correspondence, and usually this results to smaller effect that can be produced in such case of interaction. And no affinity, when the drug cannot bind to the receptor, and in this case usually we have no pharmacological effect. The second characteristic is intrinsic activity. This is the ability of some drug to cause pharmacological effect after interaction with this receptor. So here you can see three examples. In all of them we have complete full affinity. There is correspondence between the drug molecules and receptor, but the amount of the effect that is produced after such stimulation is different. In the first case, we have the drug with high intrinsic activity, and such interaction between this drug and receptor produces maximal effect. In the second case, we have low intrinsic activity drug. In this case, despite the fact that we have full affinity, the effect is smaller than in previous case because the intrinsic activity of this drug is less than in previous case. And also we have drugs with no intrinsic activity, and these drugs, despite the fact that they can bind to the receptor, they produce no effect. And usually we call such kinds of drugs as antagonists of these receptors. So, by the direction of the result of interaction with the receptors, all the drugs are divided into agonists and antagonists. Agonists are the drugs that bind to some kind of receptors, stimulate these receptors, and cause pharmacological effect. Agonists are classified into full and partial. Full agonists, they cause maximal effect. So these are the drugs with high intrinsic activity. And partial agonists, they do not cause maximal effect. Regarding the agonist, a few words should be also mentioned about endogenic ligands. These are the substances such as neurotransmitters or hormones which are normally produced in our body, and they are considered as the natural agonists of specific receptors. For example, norepinephrine or noradrenaline is the agonist of adrenergic receptors. And as you see, as a rule, these receptors are called by the names of their endogenic ligands. And the second type of the substances are called antagonists. These molecules bind to receptors, but they do not produce any stimulation of these receptors, and also they prevent stimulation of these receptors by agonists. Antagonists are further subclassified into three types, which are competitive antagonists, non-competitive antagonists, and agonist antagonists. Competitive antagonists, they can bind to the same part of the receptors which agonists can bind to. And actually both antagonists and agonists, they compete for the same receptor, which can be occupied by one of these two substances. And if we increase the concentration of the agonist near this receptor, we will result to the decreased binding of antagonist with the active site of the receptor, and opposite. The second type of antagonist is non-competitive antagonists. They bind to different parts of receptors as agonists, and by changing of the conformation of receptor, such kinds of antagonists make them non-sensitive to agonists. And the third type is agonists-antagonists. They act on one subtype of receptors as agonists and on another subtype as antagonists. For example, we have alpha and beta adrenergic receptors, and some drugs may act as the agonists for alpha adrenergic receptors and antagonists for beta adrenergic receptors at the same time. By the function, receptors can be divided into several types. First, we have ligand-gated or ionotropic receptors. They have direct influence on the ionic channels which they bound with. For example, we have nicotinic cholinergic receptors and GABA A receptors. As I mentioned before, GABA A receptors, they are linked with ionic channel for chloride, and when this receptor is activated, when it's stimulated by gamma aminobutyric acid, this ionic channel opens, which makes possible the passage of chloride ions through this channel. The second type of receptors is so-called GPCR, or G-protein coupled receptors. They may affect either permeability of ionic channels or activity of different enzymes through specific G proteins. These G proteins can be of several types. Most widely known as GS, or stimulatory G proteins, GI, or inhibitory G proteins, and GQ proteins. GS proteins, they lead to the stimulation of such enzymes as adenylate cyclase and guanylate cyclase. These enzymes stimulate production of secondary messengers, cyclic AMP and cyclic GMP, which can regulate a variety of different intracellular functions. GI proteins, they inhibit activity of these enzymes, which results to the reduction of the level of these secondary messengers in the cytoplasm of the cell. And GQ proteins, they stimulate activity of enzyme phospholipase C, which is responsible for the production of such secondary messengers as IP3, which is inositol 3-phosphate, and DAG, which is deacylglycerol. These secondary messengers also may regulate a variety of different intracellular functions in our body. The examples of the receptors which belong to G-protein coupled are muscarinic cholinergic receptors and adrenergic receptors. The third type of receptors are kinase-linked receptors. They directly affect activity of effector enzyme, which is usually tyrosine kinase, which performs the biochemical reaction of phosphorylation of proteins in our cells. And presence or absence of phosphate group significantly affect the activity of these intracellular proteins, such as enzymes. Examples of such receptors include insulin receptors and receptors for some growth hormones, growth factors. Nuclear receptors. These receptors affect the process of DNA transcription, and by this way they can regulate the expression of different genes in our cells. And examples of these receptors are steroid hormones receptors and thyroid hormones receptors. As opposed to all other types of receptors which we described before, nuclear receptors are located inside of the cell. And in order to be stimulated, the ligands for these receptors must cross cell membrane, and only in the cytoplasm of the cell it results the drug receptor complex, which is further transported into the nucleus of the cell, and there it produces corresponding effect. By the localization, all receptors can be classified into postsynaptic, which are located on the postsynaptic membrane, presynaptic receptors that can modulate release of neurotransmitter into the synaptic cleft, and extrasynaptic receptors which are located outside of the synapses. Pharmacodynamics also studies drug interaction, and by mechanism this interaction can be pharmaceutical and pharmacological. Pharmaceutical interaction is simply chemical reaction between different drug substances after their mixing in one dosage form, for example. Pharmacological interaction can be pharmacokinetic or pharmacodynamic. Pharmacokinetic interaction is the change of the drug effect due to the influence of another drug on the pharmacokinetic process of the first drug, such as absorption, distribution, metabolism, and elimination. Pharmacodynamic interaction, this is the change of the drug effect due to the interaction at the level of biological molecules, such as enzymes, receptors, and so on. So when two drugs compete for the same target, for example, for the same receptor, they interact at the pharmacodynamic level. By the direction, drug interaction can be classified into two types. The first one is synergism, the second one is antagonism. Synergism is the strengthening of the action of interacting drugs, and it can be represented with such types as sensitization, additive synergism, summation, and potentiation. Antagonism is the opposite situation. It's the weakening of the effects of the interacting drugs, and it is usually represented with such types as physiological, chemical, physicochemical, and physical antagonism. Several change of pharmacological effects can happen after repeated introduction of the drugs. These are the following. Accumulation. This process leads to the manifestation of the toxic effects of the drugs and can be represented with material and functional accumulation. Material is the increase of the drug amount in the body, and usually the level of the free fraction of the body is increased at the same time simultaneously to the saturation of bound fraction of the drug. Functional accumulation is the accumulation of drug's effect, despite the fact that the drug molecules are eliminated from the body. The second one is the drug tolerance. Actually, this term explains the weakening of the drug's effect after repeated introduction in some period of time, usually days or weeks. Tolerance may be caused by different factors, such as reduced absorption of the drug, facilitating or increasing the rate of biotransformation and elimination, or it can be caused by decreased number of receptors available on the cell or decreased sensitivity of this receptor to this drug. In order to overcome this effect, drug tolerance, usually drug dose is increased in order to stimulate the receptors for this drug, but this increasing of the dose may lead to some negative consequences, such as side effects or intoxications. One more change that may happen after repeated introduction is called tachyphylaxis. It is very similar to tolerance. It is also weakening of the drug effect after repeated introduction, but it is more rapid. It develops much more quicker as compared to drug tolerance, and usually it takes minutes or hours in order to decrease the action of the drug. Another change that may happen is drug dependence. Actually, it is the constant desire to take the drug that is represented with psychical and physical dependence. Usually this happens when we administer the drugs that affect central nervous system and modulate the levels of neurotransmitters in our brain. Next part of the video is devoted to the complications of pharmacological therapy. In any type, when we use the drug molecules for treatment of prevention of disorders, we may have some negative adverse reactions. And these side effects can be classified into several types according to the following classification. First, complications that are associated with toxic properties of the drugs. We may have negative effects of the drug molecules on the functions of different executive organs and systems, such as negative effect on liver, hepatotoxic effect, on kidneys, nephrotoxic effect, on blood, hematotoxic effect, on stomach, ulcerogenic effect, and so on. Also, we may produce suppression of immunity in our body. This effect of the drug is called immunodepressive or immunosuppressive effect. We also may have unfavorable effects of the drugs on fetus, and depending on the term of the pregnancy, these negative effects can be subclassified into embryotoxic, fetotoxic, and teratogenic effects. Next, we may have complications that are caused by changed sensitivity of the body to the drug molecules. They can be represented with the allergic reactions that are based on impaired immunological reactivity, and so-called idiosyncrasy that is based on genetically determined enzymopathy. For example, when we have genetic deficiency in some enzyme which is important in the action of this drug. And also we may have complications that can develop after stopping the drug taking, so-called cessation or withdrawal syndrome. That is the recommencement of the disease or worsening the patient's state after sharp, immediate withdrawal of the drug administration. And we may have drug dependence, which was discussed before. And finally, I would like to mention few words about the types of pharmacological therapy. Every time when we use the drug, we do it for some purpose and we want to achieve some goal. And these goals can be the following. First of all, etiologic therapy. This is the type of pharmacological therapy that is aimed to eliminate, to remove the cause of the disease. The most typical example is the usage of antibacterial agents. We know that some kind of bacteria may cause some disorder, such as pneumococcus, may cause pneumonia. And we use the drugs that kill these bacteria, and when we eliminate these bacteria, as a result, we stop the development of this disorder. The second case is pathogenetic therapy. This is the pharmacological therapy that is directed to the main chains of pathogenesis of disease. For example, some disorders involve development of inflammation, and we can use the drugs that produce anti-inflammatory effect. They stop inflammation in the body, and by this way they can be useful in treatment of those disorders in which inflammation plays a very important role. The third case is symptomatic therapy, which is directed to elimination of the clinical signs of some disease. So it does not affect the course of the disorder, but its only purpose is to remove specific signs of this disease. For example, we can use the drugs that can eliminate fever, cough, nausea and vomiting, and so on. And these are the examples of symptomatic therapy. Next case is substitutive therapy. Actually, this is the substitution by the drugs of several biological substances in case of their insufficiency. Typical example is diabetes mellitus, in which we have insufficiency in production of insulin, and in this case, in treatment of diabetes mellitus type 1, we can use insulin as the drug. And finally, we have preventive therapy, which is directed to the prevention of or prophylaxis of some disorder. The example of such therapy is the usage of vaccines for the prevention of infectious disorders. And with that, I want to thank you for watching, and I hope you enjoyed this video.